Joint pain and limited mobility do not have to be a fact of life. There are steps you can take every day to protect your joints, reduce pain and stiffness if you already have some joint issues, and maximize joint function so that you can live a long and active life. To start, get moving. Even though exercise might sound counterintuitive for someone with joint pain, it is actually well proven that regular exercise can protect your joints by strengthening your muscles. This takes stress off of your joints and helps alleviate stiffness, so you get both short-term and long-term benefits. If you're overweight, which means if your BMI is greater than 25, your joints will thank you for losing weight. In fact, if you already have osteoarthritis, losing just 15 pounds can cut your knee pain in half. If you have arthritis, you have inflammation in your joints, so you want to be sure that you are not contributing to that inflammation by what you eat. High-fat, high-sugar foods lead to inflammation, so try to avoid all fast foods if you can. In addition to eliminating those negative foods, adding in more fruits, vegetables, whole grains, olive oil, and omega-3 fatty-rich fish can actually help reduce inflammation. Also consider natural approaches, but beware, some work better than others. Glucosamine is a key building block used by the body to make cartilage, as well as the lubricating fluid that helps joints move freely. Over the years, numerous studies have been published showing that glucosamine helps maintain normal cartilage and helps improve joint function, joint comfort, range of motion, and flexibility in people with mild to moderate osteoarthritis. In a 2008 study published in the journal Osteoarthritis and Cartilage, researchers concluded that long-term glucosamine supplementation may reduce the risk of having a knee replacement by 57%. Now that is worth paying attention to. Boswellia, or Indian frankincense, is the gum resin from the tree Boswellia serrata. A key active compound found in Boswellia called ACPA has been shown to inhibit the action of enzymes involved in the inflammation process. However, research suggests that Boswellia extracts with high amounts of ACPA in combination with other naturally occurring constituents of the resin help decrease joint pain and stiffness and improve function better than the high ACPA alone. In fact, a recent study showed a significant decrease in joint pain in as few as 5 days. And of course, eating a healthful diet is always important. In fact, particular nutrients such as vitamin C, zinc, copper, and manganese are important for healthy joint tissue because they're essential in the production of collagen, which is the core structural component of the cartilage in your joints, as well as your tendons and ligaments. Consider taking an omega-3 fatty acid supplement because of its inherent anti-inflammatory properties. Chondroitin sulfate is a natural component of cartilage tissue, but studies of its benefits in chondroitin supplements have been mixed. Early studies suggested it wasn't well absorbed at all when consumed orally, while recent studies suggest limited absorption, somewhere between 8 and 18%. More importantly, recent research also suggests that when taken in combination with glucosamine, chondroitin sulfate significantly inhibits the absorption of glucosamine. MSM, or methylsulfonylmethane, is a commonly used source of sulfur. Sulfur is used by the body to make sulfur-containing amino acids, which get incorporated into proteins that make up your joint tissue. However, we tend to get plenty of sulfur from our diets, and based upon the body of literature, MSM does not appear to be beneficial for reducing joint pain. So, here are my 5 steps for healthier joints. And remember, Shaklee is here to support you every step of the way. So get active and stay well.